Day. I don't know if you saw our Instagram live, but I hope you wore your pink today. I'm here with Dr. Gina Dorfman, and we're saying the doctor's still in the office with teledentistry. Dr. Gina Dorfman, do you want to talk a little bit about yourself?
Hi, yes. So first of all, thank you for joining us. I'm a practicing dentist in the state of California. I own a practice. It's a fairly large practice. I have several associates. I have an amazing team. That's unfortunately most of them are at home right now. We chose to close the office on Monday. I am also a co-founder and the COO of a company called Yappy. Some of you may have heard about it. We provide online and iPad digital forms so that our offices can be completely paperless. We offer patient engagement, and we also offer help with reviews and a lot of other good stuff. But that's not what I'm here to talk to you about today. Today, I want to talk to you about teledentistry, because unfortunately, with the pandemic, a lot of our offices, some offices are still open, but a lot of our offices have either been completely shut down, as we were just talking before we jumped live, in Pennsylvania and other areas. The offices are completely closed, not even for emergency care. We're hearing that some of them may start to allow emergency care, but for now it's like, can't go in, send them to emergency. And then there are also offices where emergency care is permitted. But unfortunately, we need to be able to pre-screen patients. We need to know whether something is a real emergency. And some of these really don't require treatment. And this is where teledentistry comes in. Now, a great thing, and sort of like, if you have to find a silver lining, and I think that we have to look for silver lining in things, because just to stay sane in this like crazy whatever is happening world right now, what we can do is we have time. Yeah, right. So we have some time to implement things. So we can implement teledentistry to help stay in touch with our patients during the pandemic, help them, even provide comfort, guide them, show our leadership in the community. Because yesterday, my practice received calls from 3 patients that have never been to our practice, but their office has been closed. They cannot get in touch with their dentist. And I understand people are confused. They don't know what to do. Some practices, feel, some practice owners feel scared. Teams are isolated. I mean, it's just a tough time for everyone. So this is a way that we can show leadership and reassure our teams and our patients, and help pre-screen them, help prescribe medication. But this is also something that's not going to go away. Once the pandemic is over, this will be over, and we're going to go back to our practices. We can still use this as a useful tool with emergencies to prescribe for elective care, like cosmetic dentistry, implants, sleep apnea treatments, all very useful stuff. There's a lot of information. I will provide some information that's relevant to today, because there's some changing regulations as far as billing and HIPAA. I want to talk about that. There's some platforms that we can use now, but there are also some commercially available applications that can be used once the pandemic is over. So I can get started, or if you have any questions, let's start with the questions and then we'll dive right into it. Looks like no questions. So
awesome. So if you do have questions, please feel free to drop a comment. No questions yet. You're right. I do have a question. You mentioned HIPAA. We already talked to Dr. Brian Harris a little bit about teledentistry, how it works, kind of where you can go. But we had a ton of questions afterwards that talked about HIPAA. Is it HIPAA compliant? What do we have to do? Do you have any answers on that?
Absolutely, I do. So the good news is that OCR, which is the Department of Human Health Services, released a statement. As most documents released by the government, the language is a little confusing, a little convoluted. You kind of read this and you go like, do I have a reading comprehension problem? What's going on here? But they're basically saying is, during the pandemic, we're going to look the other way. we're going to use our discretion to decide what's a HIPAA violation. They're basically saying if you're using common technology, like your regular phone, I'm showing this, I don't know if you can see this. If you're using your regular iPhone to exchange Android is fine. If you're using common technology to exchange images with patients, to exchange normally protected health information, it's going to be fine during the pandemic. Once the pandemic is over, then we have to go back to our normal lives, normal HIPAA regulations. And at that time, we're going to have to start using tools that are commercially designed for this purpose. There are a couple of, actually, I've been podcasting. I forgot to mention about myself. I'm a podcaster. I have a podcast called Behind the Smiles. And on the podcast yesterday, we just released a podcast with a founder of a company that provides a teledentistry solution called Dentaloo. There's another company called Mouthwatch, and I'm going to be interviewing the founder in a couple of days. So these are the two. I have no affiliation with either company. I'm just trying to gather a little bit of information so that I can share it with my colleagues and help implement it in my own practice. So these are the two commercials. There are other commercially available products that are specifically designed for teledentistry. Now, the nice thing with those is that both of them actually come with a camera that can be drop shipped to a patient. And so it's a fairly inexpensive camera, and the patient can actually do a mouth tour of the mouth. All of that is completely compliant. It records, so you have your documentation for your chart. You have documentation that you can share with a specialist. So let's say someone calls and you evaluate the patient in a.
It looks like we just lost Miss Gina. Hopefully she's going to jump on in just a second. We have a little bit of technical difficulties right now. We'll see if she can jump back on. But if not, so what I kind of heard her saying is there's a lot of different platforms for teledentistry right now, and she's got a lot of resources for us. So if she doesn't jump back on, we're going to make sure we post those links below. But I actually see her now, so let's pull her back on the screen. All right, let's see. Dr. Gina,
there, I'm back.
Are you there?
I am back. I'm here.
You know you're working from home. You can hear your dog in the background, and there's an internet thing. So, like, we're all in this together.
I know, and I don't even know why the dogs are barking. There's nothing going on. There's no intruders, no postman. I mean, usually like Amazon truck. That creates a lot of commotion for the dogs. I mean, I think they're like, is it for me? Is it for me? Am I getting something? And they're not getting anything. They can't. They don't have the opposing thumbs to order online. So, you have the document from the ADA that goes over the billing procedure. And one of the things that we can do right now is we can bill it. And I'm getting confirmation from Aetna, Delta, United Concordia, MetLife that they will be paying a limited exam D0140. There are other teledentistry codes, but those codes are not payable. So just don't even use them. Go ahead and bill it as a limited exam. But during this exam, you can diagnose a condition, and then you can decide, do I want this patient to come to my office? You can pre-screen them for COVID-19 before you invite them into the office. And of course, my company would provide some sort of a consent form for teledentistry. We have those available. We have a pre-screening questionnaire available, and that's all part of the workflow, which I'm actually hosting a webinar through California AGD this Friday. And I will be happy to provide the link to this to you guys if you're interested. But the idea is that you can also share it with your specialist. So if you feel that patient needs a root canal, this information can then be shared with an endodontist so they can evaluate the situation. They can decide, do we want to see the patient? How are we going to see the patient? If we're going to see the patient in the office for emergency care, there are a couple of things that we recommend. First of all, use online consent forms documentation so the patient doesn't sit in your practice filling out forms with a clipboard. It's not a good idea in a normal times, but even now you don't want people touching things. You don't want them sitting in your reception room. If you pens, all of that. Don't do this. And then you give it to another patient, that just spreads the disease unnecessarily. Even if you do pre-screening, we cannot guarantee that the patient is not infectious. We have to treat everyone as though they have a disease. So have them wait in the car, have them text you that they're here, and they put them straight in the operatory. Remove refreshments, children's toys. If you have kids, then you ask the parent to fill out the minor consent form, and the parent can wait in the car while you see the kid. Even if that's not normally what you do. Like, I do a lot of pediatric dentistry, and I like to have a parent in the room because I want them to see how well the kids are doing with me, but not during this time. During this time, we got to minimize this. So, but the idea is that using teledentistry as a way to prescribe patients. You will be, now here's another thing, DEA typically requires a visit to the office in order to prescribe medication. However, during this time, they have also temporarily allowed prescribing medication after a teledentistry appointment, which is great because if you are trying to sort of manage your time or your team's time and maybe batch some of those exams. So when I say batch, I mean on the same day, not at the same time, obviously, because you don't want to have too many people at the same time in the office. But if you have two emergencies and you can both schedule them for tomorrow and then you want to prescribe something today, you can using teledentistry. Now, we were talking about HIPAA earlier. So normally, I mentioned two platforms. One is Mouthwatch and the other one is Dentaloo that you should be able to use. Both of them have a camera, inexpensive camera that patients can be using, or they have a way for a patient to snap an image and transfer it to you. And that's going to be in a HIPAA compliant way, which is going to be great when you return back to your practice and now you start screening patients for potential cosmetic treatment or orthodontics or sleep apnea. Probably not immediately. I mean, this is like sort of like, when you unplug your computer and then you plug it back in, and then it takes like, I don't know, like a minute for everything to come back to normal, right? Like you're sitting there watching that circle rotate. Right. It's going to be a little bit like that when we come back to the practice, but eventually it's all going to come back. And when it does, teledentistry is going to be a useful tool. But at that point, it's going to have to be HIPAA compliant. Also, Zoom, which is a platform that we use a lot for our podcasts and webinars. Zoom has a special teledentistry platform that is also HIPAA compliant, and there are other platforms as well. They don't have an internal camera built in, but it's HIPAA compliant and it's very useful. However, during the pandemic, you are able to use your phone. Now, in order to prescribe medication, in order to bill insurance, you cannot just have a conversation. It has to be an audio visual medium, which, like you said, that's our phone, right? So we have the best teledentistry device during the pandemic already in our pocket. And then another thing that I wanted to mention with teledentistry is that we're going to have to obviously advise our patient. Now, remember, just because OCR lifted sort of their stringent requirements on HIPAA doesn't mean that the patient cannot go after you at some later time. Now, I don't know what kind of a court would not throw out a case like this. I don't know what kind of attorney would be willing to do this. Even the hungriest attorney probably wouldn't take this kind of case. But just to be on the safe side, remember to have a consent form that specifies that we are using a device that's not HIPAA protected. And in that case, once the patient consents, then you're okay to use this technology. What questions can I answer, Melanie?
And I'm sure that when they're on your phone, hi, Melanie. And I'm sure that when you're on their phone and they're asking you these questions, that's consent in itself. Like, you reached out to us, we're doing teledentistry, you're giving us that consent that says, I have this weird thing on my tooth. Do I need to come in today? Oh, actually, that's just a popcorn kernel. Like, you could floss that out so you're okay. Or you need to go see your endodontist, or we have an appointment in the afternoon,
Oh, absolutely. Absolutely. And here's the thing. I think that for a lot of patients, like, we have a lot of phone calls. So I have some of my team still working. We have a fairly large practice, so they're not like working in the same room, but I have 2, sometimes 3 people still doing insurance billing because we want that cash flow coming in. We're working on some projects that never get, every dental office has projects that are never getting done. So we have some team still working. And actually today in my practice, we are upgrading. My husband is there. We're upgrading our computer system. So we're trying to use these times, these difficult, uncertain, scary times. We're just trying to use it as an opportunity because we know we're going to be going back. And so you have people on the phone and the phones are ringing, and there are people, strangely enough, they're still wanting to come in because they have the time. So, usually what are some of the reservations that people have? Time, money, and fear, right? So we can't deal with fear, but now they have the time. So that just eliminates one, and we're not going to treat them, but that just goes to show you that pandemic or not, people are still interested in receiving care. They have questions, they need us, and teledentistry is another way that we can stay in touch with our patients by providing them information, just like we're doing right now. One of the things that we do as a company is that we think ourselves as not just a service provider, but also an information provider. We understand technology. And so whenever new technology becomes available, we want to talk to our customers about this technology, which is kind of what I'm doing right now. Even though it's not our technology, we still want to share the knowledge, and we hope it helps. And this is one way that you can stay in front of your patients if they have questions. You mentioned flossing out the popcorn kernel, but it happens, right? And interestingly enough, so you go to the store. I was at the store a couple of days ago, and of course, there's still no toilet paper. I still don't understand this toilet paper thing, but the toothpaste aisles are full. There's like no shortage of toothpaste, right?
I know. My heart is a little broken about that. I'm like,
right. So this is job security, people. We're going to be busy, but we can also, this is an opportunity for us to educate our patients about certain procedures. So we can utilize this. We can utilize social media. I know that a lot of times a lot of my colleagues are actually hiring companies to do their social media for them because they don't have the time. They don't know how. And social media is really just getting online and talking to your audience, right? And your patients are your audience. So get online, talk to your patients, get on Instagram. I've seen some offices. This is not the time to be selling anything. This is not the time to be buying anything. But you can be a community leader. You can sort of infuse some calm and reassurance into your community, utilizing, like I said, teledentistry, social media, email, your blog, start writing for your blog, Google likes. Everyone wants to know, how do I get to the first page of Google? How do I get into the local 3-pack? By having great original content on your website. Most websites are cookie cutter, right? So you have some time, write some content, get your team at writing content. This is an opportunity for us to emerge better and bigger and stronger, and leaner and meaner and smarter. So there's my soapbox.
There's my soapbox. I would love to implement a flossing challenge because now nobody has any excuses. I know you're not going anywhere.
I like that.
We stand together and we said, okay, we're doing a 14-day floss challenge for our patients. And they jump on and do a quick live and say, here's the proper way to floss. It was funny because actually at Ultradent, I got an opportunity to teach some of my coworkers around me, like, okay, use your middle finger. And then you can use these ones to push down and like rotate your floss more. And they were in awe. And it was so fun for me. And being a dental professional, you don't think that sometimes, you're like, oh, no, they know this stuff. So I say we all implement a flossing thing right now. Like it's the new Corona challenge, floss for 14 days.
I like this. And, so what happens is I think you need like 21 days for something to become a habit.
Maybe we do 21-day challenge.
There you go. Well, we have the time. We don't know when we're going to go back. But, hopefully the sooner the better. But whatever time we get them to floss is going to be beneficial. So definitely, for me, and maybe it's just the way my mind works. I can sit at home and I can cry, but hey, there's no crying in baseball, right? You just focus on work and you get things done. This is the best we can do.
Exactly. And if you got to cry, cry, and then let's go. Time to rally. Time to show them that we're healthcare professionals. We're going to do it in a little bit of a different way since we can't really go in our offices right now, and use social media. That's a great platform for that. Use teledentistry. How can you help those friends with popcorn kernels? Like, you can still send that in, and that way you're also still using, your billing. You're not completely dry and you're not completely zero. You at least have like some sort of revenue coming in too.
Absolutely, and I think that going forward, this gives you the opportunity to learn this platform. But going forward, that's going to be a way for you to capture brand new audience. Because as I was actually sharing this with someone prior to coronavirus, I was one of those people with a lot of, I don't want to say a lot, but with discretionary income. Income was never a problem. Time was a problem. I didn't have a lot of discretionary time. And so if I wanted to have a cosmetic procedure done, my hurdle would be finding the time to take off work, to go to the office, especially that sometimes when you are interested in a high-end procedure like that, you're not going to go necessarily to the guy down the street. You're going to find someone who specializes, who has the, sort of the cloud as the cosmetic dentist in your town, or whatever the reputation that you built, the expert, or if you're offering sleep apnea, which is an amazing, this is how we save lives, right? With sleep apnea treatments and even just sleep apnea screenings. But that's how we capture new audience. And as we go forward, as we rebuild our practices, this is going to be one of the ways that we can attract more new patients to our practices who have the discretionary income, but don't have the time, and also maybe even have the time, but they need the way to screen providers and find providers who are more they can meet their needs where they are, right?
Yep, agreed. All right, well, Ms. Gina, if you wouldn't mind dropping those links in the comments for your webinar that's on Friday and any other helpful information you have. I'm going to drop a document from the ADA that kind of talks about billing and coding right now. There are a few other codes that they talked about. I am not going to confirm if this is for sure nationwide. I'm pretty positive, but it did come out March 24th, and I feel like sometimes it changes daily. So this is March 24th. Today's the 25th. It could have already changed by now.
The document that I have, and it's probably the same document that you have, and that's the COVID-19 coding and billing interim guidance from the ADA, and that's probably dating. Well, my version is March 24th. So that's okay. So that's the latest. That's absolutely the latest. I also have, and I can find it for you if you're interested, the health information. The document for the from the OCR that explains that the HIPAA requirements have been lifted. And also, check with your malpractice carrier. But I just wanted to mention this really quickly. As far as the coverage for malpractice, as long as what you're doing is within standard of care, you cover it for this just as you're covered for your regular day-to-day dentistry. So. That's not a concern. But like I said, if it is a concern, check with your malpractice carrier. Regulations for teledentistry do vary state by state. At this time, I think all bets are off, but going back, also feel free to reach out. I'm happy to share my contact information. I feel that by the time this is over, I'm going to have a lot more knowledge to share. I have a really lengthy document that explains different regulations by different states, which I don't want to bother even sharing. But if someone has a question about their particular state, reach out to me and I'll try to find it for you.
That'd be awesome.
And I wish you luck.
Thank you so much for meeting with us.
Be well. And thank you. Bye. It looks like we have a technical difficulty.
And I think that we lost.
I lost again.
All right. Thanks, Dr. Gina Dorfman. I can't tell if you're there or if you're not there, but it was great talking to you. Drop those links, and everybody, we'll see you a little bit later. We're going to be meeting with another doctor shortly. So thanks so much. Talk to you soon.